Sarah, a vibrant 72-year-old grandmother, spent decades volunteering and tending her beloved garden. But after her husband passed away and her arthritis made gardening difficult, she found herself spending more and more time alone. Her daughter noticed Sarah seemed tired all the time, had lost interest in activities she once loved, and kept saying she felt like a burden. What Sarah's family didn't realize was that her struggles weren't just about grief or getting older. They were about mental health. Here's a startling fact. 57% of seniors feel lonely, and approximately 4% of older adults aged 70 and over have depression. But here's what's even more concerning. When we talk about senior health, we often focus entirely on physical ailments like heart disease or joint problems, while mental health gets pushed to the sidelines, treated as if it's just part of normal aging. Today, we're going to explore why mental health is absolutely critical for seniors, how it affects every aspect of well-being, and most importantly, what we can do about it. This includes practical solutions that work with real-world constraints like limited budgets, transportation challenges, and physical limitations. Whether you're a senior yourself or you care about an older adult in your life, this information could be life-changing. Let's be honest about something that happens in doctors' offices every day. An 80-year-old patient comes in feeling exhausted, sleeping poorly, and having trouble concentrating. The doctor checks blood pressure and reviews medications, but rarely asks, "How are you feeling emotionally? Are you lonely? Do you feel connected to others?" We've created a healthcare system that treats the body as separate from the mind, especially for our older adults. This oversight has real consequences. More than 2 million Americans 65 and older suffer from depression, yet older adults often don't seek help. They may think their symptoms are a normal part of getting older, or they may feel a stigma about it. Many seniors don't speak up because they don't want to be a burden on their families or feel like they are just complaining. Think about it this way. If your 75-year-old father broke his hip, you'd rush him to the hospital. But if that same father started showing signs of depression, withdrawing from family, losing interest in activities, would you recognize it as an equally serious medical condition requiring immediate attention? Unfortunately, many of us wouldn't. There's also a generational and cultural component. Many of today's seniors grew up in an era when mental health wasn't discussed openly, and seeking help was seen as a sign of weakness. Breaking through these deeply held beliefs isn't easy, but it's necessary for healing. The research on senior mental health reveals a picture that should concern us all, but also empower us to act. In 2023, 1 in 3 adults aged 50, 80, 34%, reported feeling isolated from others. But these aren't just numbers. They represent millions of our parents, grandparents, and neighbors. The World Health Organization has identified social isolation and loneliness as a global public health priority, and for good reason. Social isolation is associated with a 50% increased risk of developing dementia, a 30% increased risk of coronary artery disease or stroke, and a 26% increased risk of premature death from all causes. Let me put that in perspective. The mortality risk attributable to social isolation rivals the impact of physical risk factors like obesity and smoking. If you'd be concerned about an elderly parent who was a heavy smoker, you should be equally concerned about their mental health and social connections. Perhaps most heartbreaking is this statistic. Individuals 65 and older account for 20% of all suicide deaths in the United States. This tells us that mental health struggles among seniors aren't just about feeling a little blue. They can be matters of life and death. Here is something remarkable about the human body. Your mind and body are so interconnected that you literally cannot separate mental health from physical health, especially as you age. When seniors experience depression, anxiety, or chronic loneliness, their bodies respond in measurable ways. Social isolation and loneliness can increase a person's risk for heart disease, stroke, type 2 diabetes, and a weakened immune system. Think of it like this. Chronic loneliness creates the same physiological stress response in your body as physical pain. Your immune system becomes compromised, inflammation increases, and your cardiovascular system suffers. I want you to imagine Martha, a 78-year-old widow with diabetes and mild hearing loss. After feeling isolated for several months, she notices she's catching every cold that goes around. Her blood sugar is harder to control, and she's having trouble recovering from a minor fall. Her doctor might treat each symptom separately, but the root cause could be the loneliness and depression that's literally weakening her body's ability to heal and protect itself. Poor mental health can lead to poor physical health choices, which then worsen mental health. People who are lonely or socially isolated may get too little exercise, drink too much alcohol, and sleep poorly. It becomes a dangerous cycle. Mental health also directly impacts a senior's ability to live independently and maintain meaningful relationships. Social isolation has been linked to poorer cognitive function and a higher risk for dementia, including Alzheimer's disease. Too little social activity can also make it more difficult to perform everyday tasks like paying bills or taking medicine. Why are mental health challenges so common among seniors today? As we age, many of us are alone more often than when we were younger, leaving us vulnerable to social isolation and loneliness. The reality is that our society has fundamentally changed how people age. Previous generations often lived in multi-generational homes with built-in social support systems. Today's seniors are more likely to live alone, far from adult children who've moved for career opportunities. But here's what makes it even harder: practical barriers that younger people often do not consider. Transportation is one of the biggest obstacles. When you can no longer drive safely, getting to social activities, medical appointments, or support groups becomes a major challenge. This isolation isn't by choice, it's by circumstance. Consider Eleanor, a 75-year-old former teacher who moved to a retirement community after her husband died. Despite being surrounded by other seniors, she feels lonelier than ever because she doesn't share the same interests as her neighbors. Her closest friends still live 3 states away, and she no longer drives. Physical proximity doesn't automatically equal social connection, and limited transportation makes maintaining old friendships nearly impossible. Why are mental health challenges so common among seniors today? As we age, many of us are alone more often than when we were younger, leaving us vulnerable to social isolation and loneliness. The reality is that our society has fundamentally changed how people age. Previous generations often lived in multi-generational homes with built-in social support systems. Today's seniors are more likely to live alone, far from adult children who've moved for career opportunities. But here is what makes it even harder: practical barriers that younger people often don't consider. Transportation is one of the biggest obstacles. When you can no longer drive safely, getting to social activities, medical appointments, or support groups becomes a major challenge. This isolation isn't by choice, it's by circumstance. Consider Eleanor, a 75-year-old former teacher who moved to a retirement community after her husband died. Despite being surrounded by other seniors, she feels lonelier than ever because she doesn't share the same interests as her neighbors. Her closest friends still live 3 states away, and she no longer drives. Physical proximity doesn't automatically equal social connection, and limited transportation makes maintaining old friendships nearly impossible. Practical solutions that work. The good news is that senior mental health challenges are largely treatable and often preventable. Let's explore practical, evidence-based strategies that account for real-world limitations. 1. Fostering social connections. The top way to alleviate loneliness among seniors is spending time with family and friends. But what if family lives far away and transportation is limited? The key is creating new social connections and maintaining existing ones in creative, affordable ways. Visit your local library. Many offer free programs, book clubs, and computer classes specifically for seniors. Check out senior centers. They often provide meals, activities, and transportation for a minimal fee. Explore faith-based organizations. Many offer community support and social activities. Technology connections, starting small. Video calling with family can provide meaningful connection, but even a regular phone call at a scheduled time creates something to look forward to. Libraries often offer free patient instruction on using tablets. Neighbor connections. A simple wave or brief conversation can develop into meaningful friendships. Pet companionship. Pets provide unconditional companionship, routine, and purpose. 2. Accessing mental health support. Let's normalize something. Therapy isn't just for people in crisis. It's a valuable tool for anyone navigating major life transitions. Mental health services are covered under Medicare Part B, though copays and deductibles apply. Making therapy affordable. Ask about sliding scale fees. Look for community mental health centers, or consider group therapy. Local colleges with counseling programs may also offer services at reduced rates. Transportation solutions. Ask if the provider offers telehealth options, or check if your community offers medical transportation services. When to seek help. If you or a loved one experiences persistent sadness, loss of interest, fatigue, or feelings of worthlessness for more than 2 weeks, it's time to talk to a healthcare provider. 3. Engaging the body and mind. The connection between physical activity and mental health is particularly strong for seniors. Regular movement, even gentle activities, can be as effective as medication for treating mild to moderate depression. For those with limited mobility, chair exercises, gentle stretching, water aerobics, or walking in safe indoor areas like malls. Free and low-cost options, walking groups, senior-specific classes at community centers, or exercise videos from the library. Volunteering. Volunteering allows seniors to use their skills and experience while connecting with others. Look for accessible opportunities like phone-based volunteering or helping with administrative tasks. Consider part-time work. About 44% of seniors work part-time, finding it helps with both financial security and mental stimulation. Families play a crucial role in senior mental health, but it requires intentional effort and good communication. For seniors, be specific about your needs rather than just saying, "I am fine," when you're not. Ask for help with specific things, like transportation. For family members, ask specific questions like, "What was the best part of your week?" Listen for changes in mood, energy, or interests. Understand that your parent might be downplaying problems to avoid being a burden. Learn the difference between normal grief and clinical depression. It's time to change how we think and talk about senior mental health. Recognition isn't enough. We need action. For seniors, your mental health matters just as much as your physical health. Feeling sad or lonely isn't a sign of weakness or an inevitable part of aging. It's a signal that you need and deserve support. You are not a burden for having needs or feelings. For adult children, pay attention to your parents. Mental health with the same urgency you'd pay attention to their physical health. Learn the signs of depression and anxiety in older adults and make mental health check-ins a regular part of your conversations. For healthcare providers, screen for mental health concerns as routinely as you check blood pressure. Consider the whole person when making recommendations. For communities, we need to create age-friendly environments that support mental wellness, including accessible transportation, intergenerational programming, and affordable services. I want to end with Sarah's story, which shows what's possible when we address senior mental health with practical, compassionate solutions. Sarah's daughter learned about the connection between mental and physical well-being and helped Sarah connect with a grief counselor who offered sliding scale fees. Together, they found a community garden that provided transportation and welcomed volunteers with physical limitations. Her daughter also set up a simple tablet and helped Sarah learn to video call her grandchildren. 6 months later, Sarah was leading small workshops for new gardeners, had made friends with other volunteers, and felt needed and valued again. Her arthritis pain became more manageable, she slept better, and she needed fewer doctor visits. Most importantly, she stopped feeling like a burden and started feeling like a contributing member of her community again. When we invest in senior mental health, we're investing in dignity, quality of life, and the wisdom that comes from a life well lived. The golden years can truly be golden, but only when we tend to both the body and the mind with equal care and attention. Your mental health matters, regardless of your age. You are not a burden for having needs, feelings, or struggles. The people who love you want you to thrive, not just survive. And with the right support, thriving is absolutely possible.